Hello, we are a team of George Washington Student Physical Therapy students. My name is Olivia, and I'm joined here by my colleagues, Angela, Jesse, and Julie, and we are excited to discuss exercising your way to healthier joints. We thought these memes were a fun way to start our presentation. Although diddly squats are great, we really do want to emphasize the importance of actually doing your squats to protect your joints and keep you nice and strong. The objectives of our presentation are to first help you understand how aging impacts joints. Second, understand the physical benefits of exercising on the aging joints. Third, understand how to perform 2 to 3 basic exercises that are going to support specifically the hip and the knee. And then finally, to identify a time in your schedule where you can implement 2 of these exercises into your daily routines. So the format of our presentation today, first we'll start with the basic anatomy of the hip and the knee joints, followed by the muscles that support the hips and the knees, a quick review on the impacts of aging on joints, followed by a pop quiz to make sure you're paying attention and really getting the right info in your brain. Next, we'll have the benefit of exercising to support the hips and knees, and a brief summary. Turning it over to Jesse because he will now discuss the basic anatomy.
Hello, everyone. My name is Jesse, and I will be discussing some of the anatomy behind the hip and knee. In order to understand the impacts that aging has on our joints, it's important for us to go over some of this anatomy first. So first, we'll start with the hip. The hip, as you can see here on the right in this diagram, you can see that it's a ball and socket joint connecting the head of this bone here, which we call the femur, to the pelvis, which you can see here. The acetabulum is just kind of a socket for this ball shape in the femur to fit in. It's surrounded by ligaments and cartilage that just help with extra support. And there are 6 key movements that are involved in the hip. Those movements include flexion and extension, abduction and adduction, and then internal and external rotation. And I'll show some videos so you can kind of get a better understanding of what those actions look like, since they might sound a little confusing right now. All right, so before we do that, I'm just going to go over some of the muscular support in the hip. We have 5 important groups of muscles in the hip. I won't go over every muscle, but we'll go over the major ones. So we have the glutes, which you can see here on the right in the back, in the butt region. You can see that there's 3 different muscles there that help with extension, abduction, and internal rotation. We have the iliopsoas group, which is this muscle right here, along with this muscle here. And they start in the lower back and move down to this bone in your thigh, the femur, and they help with flexion. And then you have a group of muscles here in this region that help with adduction in the inner thigh. And then we have 2 special groups that cross both the hip and the knee, which are not pictured in this diagram, but you'll see them later when we talk about the knee. But at the hip, the quads assist with flexion of the hip, and the hamstrings assist with extension of the hip. And once again, I'll show you videos of those motions. All right, so here you can see what hip adduction looks like. This is bringing the leg inwards towards your other leg. And you can see that how those muscles work there. And then on the right hand side, you can see what abduction looks like, are moving away from your opposite leg. And you can see the glutes firing to assist with that motion. All right, and now we have hip flexion and extension here. So this is moving the leg upwards towards your chest, as you can see on the left-hand side, or bending the hip, if you want to think about it that way. And then you have hip extension on the right, or bringing the leg back. And you can see the hamstrings firing here for hip extension with the glutes, and your quads firing in hip flexion to bring your knee towards your chest. All right, now we'll just go over some basic anatomy of the knee. It's a hinge joint that's filled with fluid for extra lubrication to prevent grinding of your femur on the tibia. And it's a connection between those two bones. It's surrounded by 4 key ligaments, which we won't go into detail on, but you may hear them at some point, that surround each side of the joint. And then we have 2 menisci, which you can see on this picture on the right, that once again help with shock absorption and preventing too much friction. And there's 2 key movements here at the knee, flexion and extension, which I will show in the next couple slides. Once again, like I said, we'll talk about the quads and hamstrings here at the knee as well. You can see a better picture of what that looks like. We have the quads in the front group of your thigh on the right-hand side here, and then we have the hamstrings on the left-hand side. In the knee, the hamstrings bend the knee or flex, and then the quads assist with straightening the knee or extending. And the calves may also assist with flexing the knee as well. And I'll show that in the next slide. So here you can see what flexion of the knee looks like. You can see the hamstrings along with the calves working to bend the knee. And then on the right-hand side, you can see the quads firing in order to straighten the knee. All right, and now I'll pass it over to Olivia again to talk about the impacts of aging on the joints.
So I'm guessing that everyone here likes moving, and we owe a big thank you to our joints for enabling us to walk, dance, pivot, and more. Joints are just where 2 bones are making contact together. The shapes of the bones that are connecting are not the same, which is important because that allows us to move. However, what's nice is that they have some connective tissue that provides support. As we age, unfortunately, the bones and the joints have a greater impact. And this change typically starts around the age of 30. If you take a look at the graph on the left, you can see that the y-axis shows the mass of the bone and the x-axis shows the age. So as you go along in age, the bone changes over time, decreasing in the density, which therefore makes the bone weaker. If you look at the picture on the top, the dark blue part indicates the hard part of the bone that provides the most support. And as you can see, with age, that part gets smaller. So what can we do in order to ensure that we keep the bone in the joint as supported as possible? Well, we can continue to increase our muscle strength. We can continue to do exercises to also protect our bone. So next, we've got a quick pop quiz. And if you want to pause this video and take the quiz and then unpause it, we will go over the answers. Now that you've unpaused the video, what type of joint is the hip? It is A, ball and socket joint. Number 2, what bones make up the hip joint? It is A, the femur and the acetabulum of the pelvis. 3, which of the following muscles provide the most support at the hip joint? The answer is A, the glutes. Number 4, true or false? Decrease in bone density beginning around the age of 30 decreases bone strength. The answer is true. 5, true or false? Movement and increasing strength will support your joints to keep you mobile for longer. The answer is true. And then finally, number 6, which of the 2 primary bones make up the knee joint? The answer is A, the femur and the tibia. Passing it off next to Angela, who will discuss the exercise and benefits and recommendations.
Hello, everyone. My name's Angela, and as Olivia said, I'm going to be going over benefits and recommendations for exercise. So if we look to the infographic on the right, we can see that there's both immediate and long-term effects, positive effects on the body after exercise. After a single bout of exercise, moderate to vigorous, we can see an improvement in your sleep quality, reduce feelings of anxiety, and also reduce your blood pressure. Now, if you exercise for a longer term, you'll see many more improvements. You can see improvements in your brain health as well as your heart. You can see you will have a lower risk of cancer. You'll find it easier to manage your weight. You'll see improvements in your bone and joint health, as well as improvements in your balance and coordination. For recommendation, according to the CDC, at least 150 minutes per week of moderate intensity activity, such as brisk walking, is recommended. And if this is too much of a time for you to fit within your week, 75 minutes per week of vigorous intensity exercise, such as hiking, jogging, or running, is acceptable as well. In addition to that, 2 days per week of activities that strengthen your muscles, as well as balance improving activities for at least 3 times a week, are also recommended as well. And if you have any chronic conditions, please consult your physician on whether those are appropriate for you. Right, passing it off to my next colleague.
All right, so my name is Julie, and I'm going to offer a couple examples of exercises that support both the hip and the knee joints. And I'll reiterate what some of my colleagues said. These exercises are not just great for strengthening your muscles, but the act of your muscles pulling on your bones actually increases bone health as well. So exercises are great for our joints. And I will emphasize that it's important to consult with your physician to make sure that these exercises are safe for your individual routine. So this first exercise is called seated or standing marches. It's really important to maintain a good upright posture and tightened abdominal muscles while you lift your knee up towards the sky. And whichever is more comfortable for you, seated or standing, you can start seated and progress to standing, or start with whichever position is best for you. And this exercise works the hip flexor muscles. So those are the muscles shown here in the front of the hip. Here's another exercise to support the hip. We have 2 different positions, and the muscles worked are the gluteus medius and the gluteus minimus. This exercise can be done lying down, and it's important to make sure that your torso stays stable while you engage the hip muscles to move them, to move your knee away from your body. Here's Jessie doing a knee exercise called a seated leg extension. And the motion shown here is leg extension. So again, you can see that he's maintaining a good upright posture while he lifts his toe to the sky and extending the leg using those quads. We have a couple exercises that support both the hip and the knee. This one is a bridge, and the muscles worked are primarily the glutes, which extend the hips, but it also engages the quads and the hamstrings. So the quads are in front and the hamstrings are in back. And Olivia's feet are about hip width apart, and she's squeezing those glute muscles to lift her hips towards the sky. Another exercise here is the sit to stand, or the squat. So in the first one, Olivia is starting in a seated position and she would stand up. And so this one is the modified version, but if you get to an advanced place where you don't need to actually sit down, it works the glutes a little bit more. So all the muscles in this exercise are the glutes, the quads, and the hamstrings. And in terms of dosage of exercise, it's best to consult with your physician, but basically doing about 12 to 20 of the movements all at one time, and then taking about a 30-second to 1-minute rest, and repeating those 12 to 20 repetitions 3 different times is a general recommendation. And here's Olivia doing the sit to stand.
All right, so we're finished with covering the majority of our information. This slide here represents the key items that we want you to know that we've covered today. So if you want to take a quick pause here and just glance over the information that was covered today, please feel free to do so. And then thank you for listening to our presentation. We want to emphasize to please reach out to your PCP, your primary care provider, or your doctor if you have any questions if these exercises are appropriate for you.
And after our session is concluded, please talk with another villager and decide when the best time to implement some of these exercises into your schedule is. Thanks again for tuning in.
All right, and here are our citations. Thank you again,